The landmarks of London are empty of crowds in an unprecedented way. In some places, you can count on one hand the number of people walking the streets. These iconic places are now symbols of a country at a standstill.
So here we are, Saturday afternoon on a beautiful spring day. You would expect tourists, demonstrators, all kinds of people to be walking through here. But with the galleries, shops and restaurants closed, they just aren't coming. It feels like being on a film set or on a postcard.
By contrast, the scenes in our supermarkets in the last fortnight have been pretty ugly. Panic buying leading to empty shelves. One critical care nurse made a tearful appeal after being unable to buy fruit and veg.
People are just stripping the shelves of basic foods. You just need to stop it.
Frankly, we should all be ashamed that that has to happen. It's unacceptable. These are the very people that we will all need to look after perhaps us or our loved ones in the weeks ahead.
More food is arriving every day. There's no shortage of food production. The crucial thing is that we need people to calm down and buy only what they need and to think of others when they are purchasing.
The government insists it's not planning to introduce rationing, but it's backing supermarkets who impose limits on how many items customers can buy. Food manufacturers say they've increased production by 50%.
We may not always be able to buy exactly the normal things that we would, and that actually there will be, less choice than perhaps there has otherwise been. There is £1 billion more food in people's houses than there was 3 weeks ago, so we should make sure we eat some of it.
Such are the surreal times we live in. Toilet roll has now become political.
Toilet roll is made here in this country, and they're able to expand production very, very quickly. But that is an item where, to ensure the goods remained on the shelves, the supermarkets together took a position of putting an item limit.
But more important than household stores are hospital supplies, and there is some optimism today. NHS England announced it struck a major deal with private hospitals, meaning 20,000 qualified staff will be available to the NHS. It'll also add 8,000 more beds and 1,200 ventilators across England. But many areas of the UK are still in fear of the pressure yet to come. MPs in Cornwall and Wales have been asking tourists to stay away to avoid strain on health services.
A week from now would have been the beginning of school Easter holidays. There will be many families who still have holidays within the UK booked up, cottages by the sea and so on. What is the government's advice to families about those holidays?
Well, the advice, obviously, that we've given so far is that people should be socially isolating, and the whole population should be limiting as far as possible all of it. Social distancing, and so the whole population should be distancing themselves as far as possible.
This is all our problems, and if we do it together, it will be an effective strategy. This is the time in your lifetime whereby your action will save somebody's life. It's as simple and as stark as that.
Well, the British Medical Association has called on the Prime Minister to guarantee proper protection for NHS staff and says priority testing should be made available to all healthcare workers. I'm joined now by Dr. Vishal Sharma from the BMA. Dr. Sharma, we've heard a lot over the past few days about healthcare staff concerned they're not getting the proper protective equipment and not being given for priority for testing. We've also heard a lot of promises that both of those things are happening. So as of today, what is the situation?
Well, the situation is really confusing still. So there are differences between what the government recommends for staff in the NHS compared to what's done elsewhere in the world. And that's making people anxious about what they're getting, whether they have access to appropriate equipment or not. And there are certainly on the ground, there are some supply issues. So even though there is supplies available nationally, when people need the supplies, they sometimes can't get them. And this equipment is so essential to protect not only the staff member involved, but also to reduce the risk of transmission to other vulnerable patients.
And on the issue of testing, what is happening?
So the testing at the moment, NHS staff can't get access to testing, and this is a really important thing because at the moment we have numbers of staff across the country who are self-isolating because a family member may have had a febrile illness or a sore throat, which may not be coronavirus related, but actually because they don't know what it is, they're having to self-isolate. And we need to have all the staff available that we can to make sure that they can treat patients all the time. And without that testing, we have people self-isolating for no reason.
And there have been promises that the testing will come, but as we sit here now, it's not there in enough numbers.
At the moment, there certainly isn't the capacity to do it in the numbers that are required, so it's being prioritised for patients quite rightly, but we do need to ramp up the testing quite rapidly so that staff can also be tested and get back to work.
Now, we know, sadly, from countries like Italy that many healthcare staff become infected and that in some instances they have died. What protection is there for all of those doctors that are being asked to come back into the NHS or students asked to help out? What protection is there for those people?
Yeah, so in the NHS pension scheme, there are some aspects of protection you have if you die in service. But unfortunately, we live in a scenario where lots of people have come out of the scheme, either because they can't afford to pay into the scheme or because they've been forced out because of taxation. And what we'd like to see is that the government actually makes a provision that if an NHS worker does sadly die from this disease, that actually their family will be supported and they won't be financially disadvantaged.
And obviously, we've heard today about this new deal with private hospitals that will provide a lot of staff and ventilators. That's got to be good news, hasn't it?
No, absolutely. So, as you heard, we're all in this together, so we need to make sure we use all resources that are available. Certainly, the private providers have got an important role to play in this. Obviously, they have capacity in terms of beds, and their staff are very important. We do, of course, need to make sure that the staff are appropriately trained and that the facilities are suitable for the use that we're hoping to use them for. But this is a positive step, certainly.
Well, Dr. Vishal Sharma, thanks very much for talking to us today.
Thank you very much.
Silent streets, shuttered shops and cafes, no meeting up with family or friends. The reality of social distancing, which experts have warned is likely to be needed for most of this year. So what impact is it already having, and how far are people learning to adapt? Our North of England correspondent Claire Fallon reports from Liverpool.
Hello, is it your birthday? Cheers. Oh, yeah. Happy birthday. 84 today.
First time I've ever bought a loo rolls for a birthday. First time I've ever bought your loo rolls for your birthday, is it?
Oh yes, you bought me loo rolls. Loo rolls. And celebrating, though not quite as Mavis and her family planned.
I thought I'd just put a banner on the window so she can look out at it. And we're on the phone all the time. It's just hard not to be able to be in actual contact, but we will soon.
How worried are you?
I am quite worried. I actually had a message from a friend this morning and her friend's father died not so far from here at 69. It's just quite frightening, isn't it?
But he had coronavirus?
Yeah. First one of probably many that we'll hear, isn't it? So it's quite worrying.
The morning after the night when things changed. People are still out and about, but look closer. The signs are there. Life is different. Tonight at Anfield, it was meant to be Liverpool against Crystal Palace, and not any old match, but the match where Liverpool fans hoped and believed they would win the Premier League. Game off, but pre-match pies still on sale, with a carefully spaced queue. It's where we met Eddie.
Okay, go on.
How are you getting on?
Well, I've been out since 8 o'clock this morning and I haven't done £30. Now I should have at least 60 in by now.
Like most taxi drivers, Eddie is self-employed. Like most self-employed, he's worried. And how do you feel about the difference that there is there between what's being done for people who are employed and what's being done for people like you who are self-employed?
The government have never done anything for the self-employed. We're expected to just go out and do it. They're quite happy taking our taxes off us, but they're giving us nothing in return. And when they turn around and say that they're giving up to £2,500 per employee per month for certain businesses, and the self-employed can have £94, it's disgraceful.
In Manchester last night, the queues of taxis were telling. At 7:30, hardly any after-work drinkers. If we weren't listening to the pleas to stay at home before, it seems we are now, in the most part. And back in Liverpool...
Channel 4 News.
We found a Liverpool fan stopped outside the ground, imagining.
What are you doing?
Well, I've just thought, I live not far from here, and I thought I'd come here, and I just fancied playing Never Walk Alone outside the ground for some reason. Just the inspiration and all this coronavirus thing, but I just thought, I miss going to the match and all that, and it's just frustrating Saturday afternoon, no football, can't go to the pub, but I'm not bad about the pub, it's this club, and I just fancied playing Never Walk Alone.
And so begins an age of social distancing and things that might have been, as life changes for us all, for who knows how long. Well, during the day, it doesn't really feel like a lockdown, and that's because it isn't a full lockdown. The shops are open, so people are going to go and get food, and some people are going to work. But during the evening, it feels completely different. I mean, this is Liverpool city centre. This is one of the main strips for bars and clubs. It's all but deserted. They're all closed. You can't help imagine how it would have been if that Liverpool match had have happened tonight. You've got cafe behind me closed, the famous Liverpool Philharmonic also closed. And although while we've been talking to people, there does seem to be an acceptance now of why we're being asked to do this, I don't think any of us can imagine yet all of the different ways in which this will have an effect on our lives.
Thanks, Claire. Well, we're joined now by the Mayor of Liverpool, Joe Anderson. Joe Anderson, as Claire says, life is changing for everyone, and this will have a dramatic effect on your city, won't it?
Oh, absolutely, not just in terms of health terms and the worry that we have about people's health, but the economy, the local economy here. We rely on tourism and hospitality, that sector. It generates around about £3.3 billion a year. 38,000 jobs it employs. The taxi driver, Eddie, just give you an example of what it means to him. So everybody in the city is clearly worried about what it means for jobs and the health. And it's frightening. And for me, this is a national emergency. I want government to actually, it's great what they did yesterday, but they're behind the curve. I want them to be up front. I think we need a national sort of emergency task force based with opposition, based with the TUC, CBI, banks, everybody working together to help out.
We have to concede, you have to accept there's been unprecedented financial support from the government yesterday. Unprecedented state intervention.
Well, look, I don't want to sound cheerish. I welcome what was done, but if you look at Denmark, you look at Norway, you look at other European countries, they're doing similar, if not a damn sight more. And if you look at, what they're doing in the private rented sector, very little. Yes, people are getting mortgage holidays, but that's what it is. And if you look at, the loans to businesses, we need much, much more. We need a focused, determined effort to support the economy moving forward.
I mean, they have in the last week announced help for people on mortgages, help for renters. They're going to pay 80% of salaries for staff. Now, it's acknowledged there's an issue for people like the taxi driver in Claire's report. What would you like to see for those people in the so-called gig economy, for self-employed people that would work?
Well, they, for instance, when they're taking time off work, are going to have to claim universal credit, wait 5 weeks. Then it's about £94 a week, so it's not going to help them. And if they're getting a holiday of rent, and we wait to see whether that's going to be the case, what happens to the rent? Does it just accrue, and it means a debt that they've got to pick up? So that's why I'm saying, what the government did yesterday was welcome, but it has to be almost on a daily basis here, because if we are consigning people, millions of people, to the unemployment queue, then it's going to cost us more in the long term anyway. So that's why I'm calling for this national task force to be set up, so we can respond on a daily basis, and government are listening to businesses, the TUC, the banks all need to work together.
Of course, the government would say that everything that they've done over the past week has been to try to keep people in work. But just finally, for the moment, as a city mayor, we know that food banks, for example, many people in communities across Liverpool and elsewhere in the country rely on food banks. We know some of them are having to close. What can you do for the vulnerable people in your city?
But we've set up 2 phone lines. We've had 900 volunteers that have volunteered since Thursday. I'll make sure that nobody in this city goes hungry. We're giving vouchers out to young children, to the families who are on free school meals. That will happen on Monday. We'll make sure that nobody goes hungry. We'll make sure that the voluntary sector gets supported to help the people at this time. That's exactly the spirit which we show here in Liverpool, that we want the government to show nationally.
Joe Anderson, thanks very much. I'm sure we'll come back to talk to you more about that at some stage, but thank you for now. Now, the number of deaths in Italy are continuing to soar. Latest figures show 793 people have died in the last 24 hours, another record high. While the numbers testing positive rose more than 6,500 since yesterday. There's also been a surge of cases in Spain, now the 3rd worst affected country in the world. Kamian Zeram reports.
One of the few things moving on Italian roads today, an army convoy carrying coffins from Bergamo, not far from Milan. It was confirmed in the last few minutes that nearly 800 have died since yesterday, making a total of just under 5,000. The health minister banned people from driving to their country homes this weekend, all but essential travel forbidden and strictly enforced. A solitary stroll on the beach? Come this way, please, sir. 50,000 people here have already been charged with breaching lockdown rules. In Spain, too, the numbers are rapidly going in the wrong direction. The 2nd highest number of both infections and deaths in Europe. An emergency treatment centres being constructed in conference halls, but widespread criticism of the nation's response.
Esta crisis es temporal.
The King's televised call for unity and collaboration drowned out by protesters. Confined, of course, to their balconies. Which was where French runner Alicia Nakomovitz decided to run an entire marathon, all 26 miles and 385 yards, in support of local healthcare workers in Toulouse. Just under 7 hours, it was some way off his personal best. Across the world, those who are still healthy are facing into a very different kind of life. Kurds in Iraq celebrating New Year from their rooftops. And in Jordan, those breaking curfew face immediate jail. Nation by nation, the world is struggling to comprehend the task at hand. Thankfully, no one has died in Kenya, for example, but health officials were spraying nonetheless in one of Nairobi's big informal markets.
Each Kenyan, each citizen must take responsibility to make sure that we cut the transmission, we cut the spread, and it is possible.
The continent of Africa has seen few deaths so far, but infections now total just over 1,000. In India, urbanites are flocking to the countryside. Amid warnings, rural health systems there are even more fragile than in towns. Cases so far around 300, with only 4 confirmed to have died. Nowhere is immune. Australia, which has banned foreigners from visiting, today began closing the nation's beaches. Too many people risking everyone's health by ignoring pleas to keep their distance. If any nation knows what's at stake, it's China, which after 3 months of shutdown now, is slowly and tentatively starting to come out of hibernation. But as scientists the world over warn, beware the false spring.
Kamian Zeram there. Well, earlier I spoke to Silvia Bignamini, health director for a hospital in the city of Bergamo. That's in Lombardy, in the north of Italy, the epicenter of the outbreak in that country, where the number of deaths rose by 546 in the last 24 hours, the highest daily increase there since the outbreak began. I began by asking her just how bad things had become in her area.
The situation, I can say, exploded towards the end of February. Myself, I did the first test for coronavirus in a nurse that was working in our nursing home for elderly people on the 26th of February. And after 5 days, we got the result. It was positive, but already 6 or 7 elderly people started having fever and pneumonia in that nursing home where the nurse was working. And from there, it exploded everywhere. So we did not have enough time for preparedness, and we had to deal with the emergency situation that really exploded in few days. And now the cases arose in the past 2 weeks, and still there are new cases, but I hope we'll reach a plateau, hopefully next week.
From your perspective, why do you think it has taken a grip so quickly? Is it because, as you said, you weren't prepared? Is it because of the elderly population? Why do you think it has taken such a fierce grip in your area?
We know that since the mid-February, the cases were increasing in that area, in Bergamo area, but still there was no rules and norms limiting the movement of the population. So the population continued moving around, and the cases were increasing. When all the measures were taken, it was good, I think, for the rest of Italy, Milan and other cities, the rest of Italy. But unfortunately, Bergamo area and like other cities, Lodi, Cremona, were already affected. So for us in Bergamo, it was too late. I hope for the rest of Italy and for the rest of the world, this experience would teach something, so you will be able to act promptly and earlier. And because the only thing to limit the virus is to limit the movement of the population. Even the health workers, they live in the same place. They get the virus at home. They get the virus everywhere, beside the hospital.
And so what has been the impact on the hospitals there, on health workers like yourself? How have they managed?
Of course, there is a lot of work to do in this moment. We are using personal protective equipment, but like some health workers, like myself, I was one of the first one to get the virus. I cannot say why I got it, because I used the mask and the gloves and all the protective equipment to visit the people. We have a hospital, and next to the hospital there is a nursing home for elderly people. For these people, really, when they become positive, we can just give some support to them. We cannot even send them to intensive care units, because above 80 years old, they can't go there in this moment. So this is very sad and painful for a health worker, because your mission is to save lives. And right now, in some cases, you have to just give some support.
What would your message be to the UK? We're said to be 2 weeks behind you. What would you be saying to us now?
Stay home. Don't move, because this is the only way to prevent the spread of the virus. At the beginning, we were also thinking this is simply a flu. It's not a flu. It's giving a lot of pneumonia, and it's very dangerous for a lot of people, elderly ones, but even younger ones. I have colleagues of 45, 50 years old in intensive care units. So the only way is to stay home. And for healthcare facilities, be prepared. Be prepared with personal protective equipment, much more than you think you need. And secondly, increase the beds for intensive care units and for infectious disease. We need to be remembered all the time. Wash hands and don't cough on your hands, and use masks and all these things. You need to repeat and train every day.
Silvia Bignamini, thank you so much for talking to us today.
Thank you.
More than 500 travellers from Britain and Ireland are still stranded in Peru, which says it will completely close its borders and shut down all airports by the end of tonight. The country's defence minister said this would be the last day foreigners would be able to leave the country, while the Foreign Office here says it's working furiously to arrange flights. From Peru, our Latin America correspondent Guillermo Galdos now reports.
With 4 deaths and over 250 confirmed cases in Peru, one local mayor is taking action into his own hands.
Están corriendo un grave riesgo. Están corriendo un grave riesgo. No solamente ustedes, sus hijos, sus padres. No puede ser posible que estos empresarios no puedan ver eso.
At this call center in Chiclayo, northern Peru, the staff seem to agree as the boss comes under fire.
¿Te crees? ¿Te ríes? Eres un payaso, ¿tú sabes lo que estás haciendo acá con la gente? Totalmente consciente y me están grabando. Estás haciendo correr grave riesgo a todos. Y vas a ser sancionado.
In the capital, Lima, masked soldiers guard against an invisible enemy and have imposed the most extreme measures in the region in an effort to curb an impending crisis. Lima is one of Latin America's biggest capitals, with more than 10 million people, but today it looks like a ghost town. The armed forces have been sent to the streets to keep people at home. Like everywhere else, no one knows how long the lockdown will last. At the airport, hundreds of flights have been cancelled, leaving thousands stranded.
It's horrible.
Yes.
It's horrible. There's complete chaos in there. They've shut down all the airlines now. They're not taking any more reservations.
Peru is one of the region's most popular tourist destinations, with over 4 million visitors every year. And for those still desperate to leave, the doors are closing fast. Others have taken a different tack.
We were going to try and travel until May, but I think we'll have to go back earlier.
With no flights home, they're waiting it out here in a rented flat.
We tried to ring the embassy and we can't get in touch with them over here. They're closed, so we don't know when flights will be, or
we don't have much information.
we don't know what's going on. So we booked this for 2 weeks, hopefully ride it out, and then we'll know more.
From what I've heard from friends and family back home, I definitely prefer to be here. It doesn't seem like Britain are handling it very well.
Over 70% of Latin Americans make a living outside the formal economy, surviving from day to day. But with shops shut and the streets deserted, millions in Peru alone are wondering how they will feed their families.